So what were some of the results that they came up with? Well, in these studies that were done, these studies, 325 deaths after the vaccine, they found out that the most implicated organ system was the cardiovascular system. And that included heart attacks and problems with the cardiovascular system, followed by the hematologic system in 70%, the respiratory in 11%, and multiple organs in 7%. 3 or more organ systems were affected in 21 cases. And the mean time from receiving the vaccination to death was 14.3 days. And most deaths occurred within a week from last vaccine administration. And they found that a total of 240 deaths were independently adjudicated as directly due to or significantly contributed by the COVID-19 vaccination. Now, why am I talking about this after it's happened? Because truth is revealed over time. We need to keep learning. We can learn from history. We need to know about this for the future. Remember, these were released very quickly. We need to learn from the past. We need to learn what we can do better so we can help people avoid these situations in the future. So there's much to be learned, and that's why this paper, I thought, was important. So they thought, looking at these autopsy deaths, these 3 independent physicians, after the vaccination, they looked at some of the causes of death. We talked about the cardiovascular system. It had sudden cardiac death, 35%, pulmonary embolism, blood clot, 12.5%, heart attack, 12%. And they also list the other causes. So after looking at all of this and reporting on the data and looking at every study that had been done out there through last year, they put all the information together, presented this paper just last month, and the findings, I think, is important. And they looked at these, and the consistency seen among cases in this review with known COVID-19 mechanisms, and we talked about some of the mechanisms that we now have studied, and they were able to apply that knowledge to the autopsy studies, coupled with the autopsy confirmation by physician adjudication, suggests that there is a high likelihood of a causal link between COVID-19 vaccines and death. We've also seen increased death rates over time. And then they said further urgent investigation is required for the purpose of clarifying these findings. So they thought this was important enough to bring it to the public because we need to know, and autopsy studies are some of the best ways in medicine that we can learn cause and effect.